Before we begin, this video is general health education, not personal medical advice. This is educational content, not medical advice. Ever notice fatigue or lightheadedness before your mouth feels dry? That's early dehydration. Your brain and organs need water to function smoothly. These subtle signs appear long before thirst kicks in. Recognizing them can help you rehydrate before symptoms worsen. Dehydration affects your body gradually, starting with small changes that impact energy and focus. Your body constantly balances water intake and output to keep everything running smoothly. This happens without you even thinking about it. Your brain monitors fluid levels using signals from your blood vessels and hormones. When you're well hydrated, your heart pumps efficiently, and your blood pressure stays stable. Thirst isn't the first sign of dehydration. Instead, subtle changes like fatigue or dizziness can appear before your body officially triggers thirst. This is why catching early signs matters. Before you feel thirsty, dehydration causes subtle changes. Your heart pumps harder to keep blood pressure stable, while tiny blood vessels tighten like a faucet turning low to save water. You may feel mild fatigue or slight dizziness when standing, signaling your body is adjusting to fluid loss. Noticing these signs helps you rehydrate early. Your central nervous system regulates hydration by monitoring blood vessels and hormones, adjusting heart rate and blood pressure before thirst is felt. Neural pathways control cardiac output, how hard your heart pumps, and peripheral vascular resistance, blood vessel constriction. These automatic adjustments can cause fatigue or imbalance if dehydration begins, signaling early changes to prevent issues before thirst occurs. Some people are more likely to miss early dehydration signs. Age reduces thirst because older adults produce less vasopressin, a hormone that regulates fluid balance, leading to silent dehydration. Intense exercise increases sweat loss. But if hydration isn't maintained before, during, or after, the body may adjust without noticeable signals. Certain medications, like diuretics, which increase urine production, or blood pressure drugs, can also raise dehydration risk by altering fluid balance. Recognizing these risks helps you stay proactive and hydrated. Preventing dehydration starts with habits that keep your body balanced. Drink water regularly, even when you're not thirsty, to stay ahead of fluid loss. Monitor your urine color. Pale yellow means you're hydrated, while darker shades signal it's time to drink more. Adjust your intake based on activity. Intense exercise or hot weather means extra fluids before, during, and after. Certain factors, like age or medications, e.g., diuretics, can make dehydration harder to notice. So stay proactive. These steps support your body without overpromising results. You might think drinking more water always prevents dehydration, but that's not always true. Some factors make it harder for your body to send clear signals about needing fluids. For example, certain medications, like diuretics, which increase urine production, or blood pressure drugs, can raise the risk of dehydration going unnoticed. Recognizing these risks helps you stay proactive and hydrated. Preventing dehydration starts with habits that keep your body balanced. Drink water regularly, even when you're not thirsty, and monitor your urine color. Pale yellow means you're hydrated. Darker shades signal it's time to drink more. Adjust your intake based on activity, like intense exercise or hot weather, which require extra fluids before, during, and after. Sometimes dehydration doesn't just mean feeling thirsty, it can lead to serious symptoms like dizziness, rapid heartbeat, or confusion. If you experience these signs, especially after heavy sweating, illness, or certain medications like diuretics, it's important to seek medical help right away. These symptoms can signal severe dehydration, or even conditions like sudden cardiac arrest, where the heart stops beating. While drinking water helps most of the time, some situations require professional evaluation to ensure your safety. Thirst isn't just your brain saying drink water. It's a complex signal that often arrives after dehydration has already begun. Your body uses neural pathways to regulate fluids, adjusting heart rate and blood pressure based on signals from receptors in your blood vessels and hormones. These mechanisms kick in when your blood volume drops, but by then, your cells may already be stressed. Preventing this involves drinking water regularly before thirst hits, especially during activities like intense exercise or hot weather, where fluid loss accelerates. Monitoring urine color pale yellow means you're hydrated, helps catch early signs of dehydration before symptoms like dizziness or confusion appear. Chronic dehydration thickens your blood, making your heart pump harder to circulate it. While this doesn't directly cause joint disorders or serious heart risks, staying hydrated helps maintain healthy blood flow and lubricates joints like oil in a machine. Think of cartilage as your body's natural cushion. Without enough water, it can feel less flexible over time. Hydration isn't one size fits all. Your body's needs change with activity, climate, and even your age. For example, menopause can increase fluid loss, making consistent hydration more critical to avoid strain on your heart or joints. While staying hydrated supports healthy blood flow, it doesn't guarantee prevention of conditions like joint disorders or sudden cardiac arrest. Tailor your intake, sip water regularly during exercise or in hot weather, and monitor urine color. Pale yellow is ideal. Lifestyle adjustments, like setting reminders or carrying a water bottle, can help you stay ahead of dehydration without overpromising results. This video is for education only. It's not medical advice. While hydration helps your heart and joints stay healthy, it won't stop sudden cardiac arrest, SCA, a dangerous condition where the heart stops beating unexpectedly. Without fast action like CPR or a defibrillator, SCA can be fatal in minutes. Always see a doctor for personal health guidance. Remember, this is general health education, not personal medical advice. For individual guidance,